choice of assessment today is going to be the overhead squat. Why I decided to pick this assessment is it's a full body assessment overlooking the entire kinetic chain, which starts from the ankles, knees, hips, as well as to the shoulders and the head. Its main action is to identify all movement compensations. In a sense, it can be used in multiple types of settings, and that's something I'm going to get into a little bit as we look over the strengths and the weaknesses. One big thing for this that we find that's great is that it's proper for all ages. It's a low intensity movement that provides a good look for either the practitioner or trainer or any fitness professional to identify if there's lacks in either muscle imbalances, joint movement, and so on and so forth. Another great thing is it's inexpensive to perform. Generally, a lot of this is performed, and I'm moving to the weakness side. A lot of the studies that show it's performed on a force plate and it's also performed with camera analysis. That's not something that's always seen in gym settings, any fitness settings, which a lot of us will be in if this is something our career decides to move into. But it's also perfect if you do have it. So if you do have that, kudos to you. It's very inexpensive for trainers like myself, as well as for a physical therapist or for any other individual that can perform this. It can be done in any type of setting. So you can do it at the park or you can do it at home. But this will give you, again, a better analysis of how your body moves. Another great thing for this is that it sets up for other assessments. So other assessments either using the goniometer, using the ability to see if the shoulder is imbalanced or if it's coming from the ankle or the calf, or assessments such as the Thomas test, where therefore can go forward. For the weaknesses, when we look at it, it really does depend on who's grading the overhead squat. The overhead squat has different types of regulations. It can be graded either from 1, 2, 3, which is from the FMS protocol, or based upon NASM, the National Academy of Sports Medicine. They have their own subjective lining, and really every individual will grade differently based upon what they believe an ideal squat is, and also based upon what an ideal joint movement is. Another thing that is a weakness or is not the best to the overhead squat is that there is gender differences when performing it. Between male and female, we look at joint angles and also bone structure. It shows to be differences in between, and all studies prove different, if I may say. And the last, it's unorthodox. Not every day that we walk around in a squatted and an overhead position. And so really this movement should be practiced if in the event, which a lot of the movements or compensations that we see when performing the overhead squat could be due to the lack of practice. And so really that's what we're going to be getting with today. And just in a little bit, I'm going to show you what the overhead squat looks like.